Hello, everyone. I think we're live now. Our webinar is going to begin and we're streaming on YouTube. Hello, everyone, and welcome to this UNRISD webinar, Lives or Livelihoods, Protecting and Supporting Vulnerable Groups Through the COVID-19 Crisis. I'll be chairing this event, and I'd like to thank you for joining today. My name is Jennifer Friedman, and I'm the head of communications at UNRISD. UNRISD is an autonomous UN institute that carries out research and policy analysis on the social dimensions of development. Through our work, we aim to ensure that social justice, equity, and inclusion are central to development thinking, policy, and practice. We are here today to launch a new UNRISD report that grew out of one question: how are interventions to address the COVID-19 pandemic affecting vulnerable groups? Just over 2 months ago, UNRISD opened up a survey with the hope of gathering and quickly analyzing responses from members of our global network. And indeed, our network came through, sharing a wealth of expertise, informed assessments, and unique insights, as you will read in the report and hear in the presentations today. Before we turn to the substance of our event, however, I have a few housekeeping announcements. First, for those of you who are attending the webinar, please use the Q&A feature to type in your questions. I will then put as many of those as possible to the speakers when we get to that portion of our event. Second, the UNRISD report is now available online. Please visit unrisd.org to access your copy. And third, this webinar is being live streamed on the UNRISD YouTube channel, and the recording will remain available there afterwards. Make sure to subscribe to our channel and follow UNRISD on our other social media as well. Now to begin, we are honored to have with us for opening remarks Dr. David Nabarro, the WHO Director General's Special Envoy on COVID-19 Preparedness and Response, co-director of the Imperial College Institute of Global Health Innovation at the Imperial College London, and former special advisor to the UN Secretary General on the 2030 Agenda for Sustainable Development and Climate Change. David, the floor is yours.
Thank you so much, Jennifer. And actually, when the invitation came to participate in this UNRISD event, I didn't need any persuasion, because for me, UNRISD is a hidden jewel in the UN crown. I've always liked it because it is an independent and autonomous institute, and it does look at equity issues full frontal. It basically doesn't duck away from some of the difficult challenges that are really so evident in our world today. And in a second, I want to tell you why, for me, this matters so much when it comes to COVID. You see, I'm lucky because I've worked over the years on the Sustainable Development Agenda. I remember in 2012 being in Rio de Janeiro when governments came together to say, well, what will we do after the MDGs? And the conclusion was, let's go for an approach to development that is truly global, truly universal, applies to all countries and all people. And so over 3 years, they negotiated the Sustainable Development Agenda. And right at the heart of that agenda was the notion of equity and justice, equity and environmental well-being, equity and long-term sustainability with regard to climate and other such issues. And I've subsequently worked on that agenda and encouraged people to be systems leaders in focusing on that agenda. And then in January, Tedros, who's the Director General of WHO, World Health Organization, said, could I come and work with him as one of the envoys? And I must say, even then, I thought this is a really difficult one. Because we've had other outbreaks, we had avian influenza in 2005. We had an influenza pandemic in 2009. We had Ebola in West Africa in 2014 and 2015. I worked on cholera in Haiti in 2016. But none of those is anything like this. It's a new virus for a start. And we don't know an awful lot about coronaviruses. There aren't many of them. We've had a bad coronavirus before in 2003, caused SARS, which is a disease that was very unpleasant in East Asia. We've had another one called MERS, which has been pretty much in the Middle East. This new coronavirus is incredibly easily spread, and it doesn't kill many people. And actually, that's a very bad combination, because a virus is more likely to stick around if it doesn't kill a lot of people. And a virus is more likely to cause trouble if it's incredibly easily transmitted. This virus is so easily transmitted that you can have an outbreak doubling in size in 2.5 days. Now, that's actually really bad news, because you then have outbreaks that increase in size exponentially. So in a week, it gets 8 times bigger. In 2 weeks, 30 times bigger. In 3 weeks, about 400 times bigger. In 4 weeks, it's grown in size by 1,000 or more. In 5 weeks, it's 10,000 or more. What this shows us is that if you turn your back on this virus, or if you miss it and it's just being transmitted, that suddenly and very quickly, you have a huge problem on your hands. And that's why countries that have moved quickly when the coronavirus comes in are the countries that have been able to get ahead of it. And the countries that have moved slower have got a much bigger problem. That explains, for example, why many of the countries in East Asia have actually been able to get ahead of their virus, so that if any new cases come in and new outbreaks start up, they can be suppressed really fast. Whereas, if you've got a delay, if you wait 4 weeks, for example, while you decide what you're trying to do about your coronavirus, you've got a huge problem, 1,000 times or more bigger problem to deal with. If you wait 5 weeks, it's even bigger still. And that's why the countries that have moved slower have got more to deal with. And surprisingly, some of these countries that have moved slower are also, in developmental terms, some of the most advanced countries in our world. They've got a lot of virus. So if you want to deal with this, what do you have to do? Answer: just maintain really strong defenses at the community level to stop this virus from spreading. And it's super basic. You find people who've got the disease, you isolate them. You find their contacts and you isolate them. And in doing that, you interrupt transmission of the virus. And if by any chance you've got quite a lot of people who've infected, as is happening in some parts of the world now, you have to bring in a lot of assets, and then you suppress the outbreak. You restrict movement locally, and you isolate people who've got the disease. Meanwhile, doing your best to support the rest of society so they can get on. Well, not all countries have proved able to do this. One problem is they have not got the capacity to engage their people and really make sure their people fully understand what's got to be done. But when we saw this starting up at the beginning in East Asia, we saw many governments there saying to their people, this is a bit like 2003, it's a bit like SARS, we're going to have to take it seriously, we're going to have to really change the way in which we live for a period of time. We may have to have a period of movement restriction, but we've got to get rid of this virus as effectively as possible. And that's what was done in China. It's what's been done in Singapore. It's what's been done in South Korea and in Japan and in Hong Kong and in Vietnam. Now, obviously people say, well, do you trust countries? Do you trust the information you've got? And in the World Health Organization, we do rely on the information that comes from governments, but it's hard to hide this COVID because it's a dangerous virus and it does cause quite high levels of suffering and death. And that means that, yeah, if you've got it, it gets picked up sooner or later. So we actually do believe that the countries of East Asia took advantage of SARS, got their people fully on board, made sure that there was basic public health capacity to interrupt transmission. They also adapted their hospitals so that they could deal with people with severe illness quickly. And they got the whole of government behind the idea that getting ahead of this virus is a vital national priority. From the president to, for example, the provincial governor, to the local authority, involving business, involving civil society, involving professional organizations, involving the media, just saying, we make this number one priority for everybody. Now, there were countries that were slower and they've got more virus. There are countries where there are quite big differences of opinion between the presidents and different advisors and local leaders. They've got big problems because this virus is very stealthy and it finds its way between leaders who are not agreeing. So 3 things to remember. Number 1, make sure that people are fully engaged. Number 2, focus on the place where people work and live, because that's where the transmission occurs. Number 3, make sure you've got strong public health services in place to be able to interrupt transmission and to make sure that that outbreaks are properly suppressed. Last point. Who's getting this disease at this time? It's not the rich. It's not even really the middle class in most countries. It's poor people. Why? Because poor people tend to be working in jobs where the opportunity to maintain physical distance and to protect yourself is quite limited. Poor people tend to live in places where crowding is common and where physical distancing and isolation is difficult. Now, in Europe and the US, it's very much higher suffering when you look at the figures among Black people, among Hispanic people, and lower among white people. Very much higher among men than women. And most of the evidence suggests that that's because Black people find it harder to access health services, and Black people tend to work in jobs where they have less ability to negotiate to be able to keep safe and healthy, less ability to take time off. So whether you like it or not, this COVID right now is a disease of poverty, powerlessness, inequity, and injustice. It's advancing fastest in poor communities. It's advancing fastest in places where poorer people work, in places where poor people tend to be of a different ethnicity. They're getting hurt the most. And it needs to be addressed through an equity lens. It's no good saying, oh, well, it's poor people who've got this disease. We will just forget about the poor people and just have the rich people look after themselves. We will end up with a totally skewed world. We will end up with vast parts of the world cut off from the rest. We will end up with vast parts of the world which are not connected by flights. We will end up with tourism markets completely destroyed and more people out of work. So we have to recognize that we have to approach this. And so to my final point, most of the containment measures that have been adopted by governments, whether it is countrywide movement restrictions or more localized movement restrictions actually end up hurting poor people the most. Look at what's happened in India, where you've got hundreds of thousands of people who had migrated from the rural areas to urban areas to work. When the lockdown started, they got stranded. And then they spent ages getting back to rural areas. And there was very little to support them because the NGOs didn't have the resources. And so it's been a really, really heavy thing for migrant labor in India. It's been bad for migrant labor in the Middle East and in Singapore. It's been bad for people who are working as migrant laborers in the agriculture sector in Europe and the US. And it's bad for people working in the garment sector in the Midlands of England. Essentially, this is a problem for people who are on the poorer end of the scale. And we've got a chance to deal with it, but we're going to have to address some of these systemic inequities and injustices in the way people live. That might help us to be good at dealing with other existential challenges like the destruction of nature or climate change. Thanks for the chance to make these remarks.
Thank you so much, David. I really think you've set out the context for our discussion today. Really pointing to the unique challenges of this virus in particular, and also really bringing home for us how this is a disease of poverty, powerlessness, inequity, and injustice. I think that really sums it up in 4 key words for us and sets out the context for our next speakers. I'd like now to thank you again, David, and to turn to the presentation of the UNRISD report by its authors, Paul Ladd, the director of UNRISD, and Eva Bortolotti, consultant. Paul, the floor is yours.
Thank you, Jennifer. So I think Ava's going to share her screen with the presentation now. Great, thank you, Ava. I just wanted to give a brief introduction to the survey to start off with. As Jennifer mentioned, the objective of the survey from our side was to provide insights in as close to real time as we could get on how policies and interventions could be better designed to meet the needs of vulnerable individuals, groups, and communities. And we felt that this was important not just for the first wave that people thought they were going through, but also for future waves as we learn to live with the virus and future spikes and future outbreaks. The survey respondents were drawn largely from UNRISD network, which is academics and practitioners, UN agencies, think tanks, NGOs, and broader civil society. So a caveat that the survey is not a representative survey that determines direct and indirect socioeconomic impacts. Instead, it's an attempt to uncover broad trends, key commonalities and differences by income and geography. The survey was available in English, French, and Spanish, and respondents were also encouraged to complete it in their own language if their web browser software allowed. So we had 329 responses covering 82 countries. We had more responses for upper middle income and high income countries, but a good share also for low and lower middle income too. We had a good geographical coverage. 53% of the respondents were female, 44% male, and 3% not specified. A fifth of the respondents were aged 20 to 34, and 14% were over the age of 65. How we use the information is that we analysed carefully the responses that we got for each question that we posed. And we tried to pull out the main trends that were being repeated across all countries. And the report only presents those trends for which a significant number of countries or responses clarified that that was happening. So we're not presenting on just 1 or 2 presentations of an issue. It's where it's been covered in 20 countries or 16 countries or 25 countries. And what was interesting was that these trends were apparent across countries of all income levels and of all geographies. The exception to this is where we have got really useful information and insights from case studies or good examples, particularly where non-state actors locally have stepped up to provide particular support to vulnerable groups. Now, what do we mean by vulnerable groups? Now, some of you may have come across the UN framework for the immediate response to COVID-19, which sets out 13 key at-risk populations. Now, 92% of our survey responses corresponded to about 11 of those groups. And really at the top of the pyramid, the top two were people living in extreme poverty or facing insecure work and incomes, and older persons. But also we had a significant number of responses for people in the informal sector and migrant workers, migrants, refugees, stateless and internally displaced persons, adolescents, children and youth, especially girls and young women, and women themselves. And then slightly fewer responses, but still a significant number for slum dwellers or people in insecure housing, other minorities, persons with disabilities, people living with HIV/AIDS or people with pre-existing health conditions, and Indigenous peoples. So I just wanted to set the scene on the survey itself, and now I'm going to pass to Ava to talk through the main findings, and I'm going to come back at the end and talk about some of the implications for future research.
Perfect. Thank you, Paul. So I will now walk you through the main findings of the report, trying also to give you a flavor of the numerous examples that respondents highlighted in their answers, as Paul mentioned. So after identifying who are the vulnerable groups present in their countries, respondents were provided with a list of interventions and were asked to identify which of these had been put in place by their governments and how effective they have been in supporting and protecting vulnerable groups. Government intervention were precise and less effective in low-income countries. Some differences emerged also by geographical regions, with testing and tracing and physical distancing particularly ineffective in sub-Saharan Africa and also in South Asia. In general, responses supported the narrative that people around the world face the choice between lives and livelihoods. Lockdown and physical isolation policies were perceived as less effective in low and lower middle income countries, if not accompanied by complementary social and economic support policies and by ineffective food distributions. Families did not have the options to stay at home if there were no other source of income or food, and high levels of poverty for workers in the formal sector were also noted. For example, cash transfer for informal workers in Algeria were described as too slow because of poor ministry coordination. In El Salvador, one respondent highlighted that food donations and transfers were undermined by lack of information and transparency. Border closures were perceived as a successful policy to prevent virus spread in countries of all income levels, and hence effective to protect everyone, and in particular the indigenous population. However, they were still less effective in some specific contexts. For example, Myanmar, it was noted our border closures came too late, were undermined by economic necessities, and often overcome by bribery. School closures were also seen as an effective policy to prevent the spread of the virus in many countries across all income levels. However, there were some concerns that school closures would exacerbate education inequalities because poorer households were less connected. Specific references then to vulnerable groups became more apparent in responses from high-income countries. In the United Kingdom, there was a significant shortfall in support for people from Black minority, especially those working in healthcare. The impact of the crisis on older persons also emerged as a common theme, particularly noted in upper, middle, and high-income countries. For example, the lockdown of care residents was seen as coming too late in Canada, Hungary, Spain, and the United Kingdom. Finally, it was highlighted the efficacy of the communication campaigns in Uzbekistan, Argentina, Costa Rica, Cuba, and also France. Respondents to the survey also revealed some important differences between the policies implemented in urban and rural areas. Certain policies were seen as more important and necessary in urban areas. This was the case for financial support for business and worker, being business usually based in urban settings, and emphasis was placed also on food distributions, made food self-sufficiency usually lower in urban areas. Furthermore, due to the higher density of the population and the frequent presence of informal settlement and slums, as also Navarro mentioned, It was highlighted the importance of distributing protective equipment such as masks and making tests easily available. Rural areas instead were described as facing unique challenges, as for example, weak data system due to low media coverage and political representation and lack of appropriate health infrastructure and testing capacity. Respondents in low and lower middle income countries also cited a low level of awareness, as in Nigeria, where rural population was described by one respondent as refusing to believe in COVID-19. On the positive side, it was noted that it was far easier to implement and respect physical distancing in rural areas. Also, the mobility between the two was recognized as a significant challenge in some countries, and in particular in India, where respondents highlighted the likelihood that migrants returning to rural areas were bringing COVID-19 with them. Survey responses also highlighted some difference in support received at different governmental levels. However, the described relationship between national, state, and local government varied widely across countries. In almost 30% of countries, mainly low and middle income, respondents felt that there was little or no government action. Some local governments organized food distribution, but many concerns were raised about misallocation and corruption. However, some specific examples emerged of local governments providing financial support, food and medical supply. In Lithuania, local governments provided food for the elderly and transport for testing facilities. In the municipality in Bogota, in Colombia, provided a minimum guaranteed income. Then the survey further explored whether the policy implemented affected men and women differently, with the objective of understanding when policies had a gender dimension. Nearly 60% of surveyors' answers identified meaningful gender differences, mainly affirming that women are more likely to be negatively affected compared to men. First of all, it was raised that women's caregiver burden at home is significantly increasing as a consequence of confinement measures and school closures. In more than 30 countries, activities as childcare, homeschooling, medical assistance to the sick, and increased or undefined working hours were identified as the cause of the increased workload and psychological stress for women. More awareness of the problem emerged especially in high-income countries, as for example, Germany, South Korea, Switzerland, the United Kingdom, and the United States. Women were thought also to be increasingly exposed to the risk of domestic violence, harassment, and unwanted pregnancies. This issue was raised concerning numerous respondents in India and in South Africa. And in Uganda, one respondent mentioned of a few women have been killed by their husbands and had to go to a hospital with serious injury. Women were also described as being more likely to face income insecurity and be at a greater risk of not receiving government support compared to men. Their precarious economic condition was reported particularly by respondents in low and middle income countries, where women are more involved in informal activities such as domestic work, petty trading, agriculture, catering, and cooking. Because of the absence of work, women also become exposed to new risks, as for example, sexual exploitation. In Lusaka, Zambia, it was mentioned that women who choose to continue informal street vending activities are becoming vulnerable to sexual exploitation from local gangs. Then, due to the gender segregation of the labor market, women experience more stress due to the longer working hours, and they face a higher risk of contracting the virus. In fact, in numerous countries, a higher percentage of women work in the healthcare sector, in retirement homes, and in a number of other essential activities in the food and service sectors. This was mentioned in particular in high-income countries, as for example in the United States, where women working as nurses in non-hospital setting were described as not provided with adequate protective equipment. Survey respondents also described how cash transfers and confinement measures have been implemented differently between the sexes, and often favoring men. In South Korea, cash transfers are transmitted to women only if they are registered as the head of the household. In Colombia, major cities, confinement measures have been implemented on a gender basis, with men and women allowed to go out on alternate days. Then, when women are adopting the role of the head of the household, they have been struggling with both financial and childcare burdens. This was raised, for example, in the Maldives, where over 40% of households are headed by women and are likely to be poorer and more vulnerable. Furthermore, women, and particularly pregnant women, also have more limited access to healthcare compared to the pre-crisis setting. For example, in Nigeria, due to the closure of maternal clinics, pregnant women do not have access to a safe environment to give birth. Lastly, the respondents are generally advocated for a more gender-sensitive policy design and implementations. Respondents highlighted how policies tend to be gender maligned and that women's voices are not captured in decision-making. Then survey respondents were asked whether the policies put in place by government to respond to COVID-19 had some kind of unintended consequences. And many were reported, both positive and negative. On the negative side, as we already mentioned, responses for over 20% of survey countries registered a rise in domestic abuse against both women and children as a strong unintended consequence of the lockdown and the isolation. In about 15% of countries, there have been perceived rises in police violence, crime, bribery, and corruption. For example, crime was seeing a rising in Nepal and Nigeria because of poverty and hunger and the lack of alternative livelihood options. Some respondents also describe how the crisis as exacerbated social inequality, for example, in relation to education. On the positive side, instead, positive dynamics have been perceived in upper, middle, and high income countries, in particular in relation to family life, friends, and society. And also community solidarity initiatives for health workers were also noted. In about 15% of countries, respondents have noticed improvements to the natural environment, in particular also cleaner air. Then respondents were asked about the evidence of non-government groups providing support or alternately vulnerable groups organizing themselves. Finding revealed that non-government groups providing significant support across all countries, often playing a major role in the fields where the government fails to provide social assistance or in the location under the reserved by public services, such as slums and rural areas. In this slide, you can see the most active non-government actions mentioned by our respondents in order of relevance. NGOs, indeed, including also UN agencies and in particular food banks, are the actors that emerged as most active. This trend was evident in particular in low-income and lower middle-income countries, where the valuable work of both international NGOs and local NGOs for food provision and health assistance was underlined by numerous respondents. The International Red Cross, in particular, stood out as an NGO very active. An example was the Maldivian Red Crescent COVID-19 Migrants Relief Fund that was established in the Maldives to support migrants facing the socioeconomic impacts of COVID-19. NGOs will also be active in high-income countries. An example was reported in Australia, where numerous NGOs are providing psychological and mental support. The second most important group of actors, as been identified by respondents, is composed of local grassroots organizations, neighborhood communities, and also local think tanks. In South Africa, the Cape Town Together Community Action Network has been formed organically by citizens who volunteer their time and skills to assist and transfer resources to the most affected neighborhoods. The private sector has been also identified as another actor that played an essential relief role. Respondents made several examples of the contribution of cooperative, social and solidarity economy enterprises, as well as larger corporations. In Mali, the National Network of Support to the Promotion of the Social Solidarity Economy is working with local artisans of the textile and food processing sectors for the manufacturing and distribution of sanitary products and food. Also, faith-based groups and organizations are providing assistance to the most vulnerable communities, often with food distribution. In the Philippines, private Catholic schools are opening their doors to homeless people, and they have also provided shelter to frontline health workers. Trade unions have also been very active across countries of all income groups. They formulated recommendations to protect the health of employees with the reopening of factories or provide assistance to urban workers for the restarting of their activities. On the other side, survey results reported only limited evidence of vulnerable groups organizing themselves. A few examples anyway emerged for all income group of countries, and you can have a taste here in this slide. So you can see, for example, women groups raising funds and sewing masks, domestic and sex workers initiating advocacy campaign. In India, migrant workers demonstrating against the government for the reactivation of public transport to come back to their rural homes. And also gig working in the US, denouncing working conditions at Instacart, Amazon, and Whole Foods. But why? So why was it so difficult sometimes for them to organize themselves? So the results also revealed of both non-government groups and vulnerable groups are encountering numerous obstacles in organizing their activities. And firstly, their operation were of course limited by the confinement measures, but this also limits the freedom of expression through marches, demonstrations, and furthermore, non-government actors also often lack the means and resources to implement the project, right? So an American NGO, for example, made example that they have to sought a loan to pay this employee during the COVID-19 crisis. Vulnerable groups initiative were also described as too limited and too fragmented to organize. And lastly, vulnerable people as the poor and the elderly often lack the technological knowledge and resources to organize safely during the lockdown. For example, lacking the access to internet. And then in the final question of the survey, respondents were asked what more could be done to protect and support vulnerable groups. And a first trend that emerged was linked to social protection policies. And in particular, social protection mechanisms linked to the provision of basic services as food, water, and shelter. And they were highlighted in particular in low and middle income countries. Also in 30 countries, the provision of financial support through scaled up unconditional cash transfer or through basic safety nets was also identified as a priority. Respondents instead from high-income countries were more likely to emphasize fewer approaches to social protection, proposing the introduction of a basic income or existing policies on a minimum wage. Other proposals center instead on support for employment and livelihoods. These included loans and grants both to large businesses and SMEs to follow staff and guaranteeing a proportion of salary or to safely restart their activities as the lockdown eases. In some countries, also specific support for vulnerable groups was proposed. An example was the establishment of employment programs for vulnerable people, such as migrant workers, daily wage laborers, and youth. Another point that was raised was the need for more inclusive and responsive institutions. In about 1/5 of countries of all income levels, it was highlighted the need for more inclusive bottom-up approaches that includes also representatives of vulnerable groups in policy design, decision-making, and implementation. And then to increase the effectiveness of the response, proposals were made also for greater transparency and accountability, to eliminate corruption in the distribution of aid, as well as for the establishment of governmental advisory bodies to ensure that decisions affect citizens equally. Respondents in about 1/5 of countries also stressed the importance of having reliable data on vulnerable groups, including through leveraging digital technologies. This information could then be used to tailor support and services and understand the influence of poverty and discrimination on mortality rates. Respondents also advanced some proposals regarding healthcare and medical support. In about 30% of countries, it was stressed the need to improve public health campaigns and education, especially for rural population in low-income countries that have less access to digital technologies and are less aware of the consequences of COVID-19. In high-income countries like Belgium, Australia, and the United States, a key intervention was identifying the reduction of the cost of treatment, or preferably ensuring free medical support for all. Respondents for countries across all income levels also pointed the need to have different strategies to different contexts and groups. For example, approaching physical distancing, testing, and medical support differently between urban and rural areas. And also bringing more attention to age-responsive healthcare that was pointed as a priority in the Philippines, Brazil, and Spain. Lastly, respondents advocated for more collaboration and solidarity. Across countries of all income levels, it was raised that government support should be complemented by increasing collaboration with and funding for non-state actors that are already working with those vulnerable communities. And in this regard, the expansion of public-private partnership was also proposed in countries as Yemen, El Salvador, India, and Paraguay. So now that you have a bit of a flavor of the main findings from the report, I will give the floor to Paul that will illustrate the areas for further research. Thank you.
Thank you, Ava. So far, we've seen the perspectives of survey respondents on the efficacy of policies put in place by governments and others, as well as their ideas on what more can be done. For UNRISD, with our mandate in the UN for research on social development, the survey responses also resonate with much of our previous research and point to topics for quick further investigation. And I wanted to conclude this presentation with some thoughts on 5 of these. And the first is vulnerability itself. Now, individuals and communities and groups can be vulnerable for many reasons: poverty, geography, inequalities, discrimination due to age, gender, ethnicity, disability, and indeed any other characteristics. Now, these vulnerabilities and discriminations can overlap, but local context and individual circumstances determine the dynamics of that interaction. So the first thing is we need to understand better the characteristics of individuals and groups and the reasons they face vulnerabilities if we're going to provide proper support. And in doing so, it's important to take what we would call an intersectional approach, informed by perspectives offered directly by those affected. Now, states are the primary duty bearers, but it's important to remember that people and groups facing vulnerability often have the agency to improve their own situations, provided they're not pushed further behind. The second is on universal health and social protection systems. Now, the pandemic and many of the survey responses we had highlighted once again the importance of maintaining universal systems that provide essential services and social protection for all. Now, lack of access to healthcare through this pandemic has implications not only for individuals themselves and their families, but also the health of entire communities, from local to national all the way to global. Now, the crisis has shown how health and broader social protection measures are interconnected. Lockdowns didn't work well in poorer settings because there was nothing to replace lost income or food. Now, governments often try to target the support, believing it's more efficient than universal systems. Now, this doesn't work very well even in high capacity settings, but it especially doesn't work well with a rapid onset pandemic if you lack the information on potentially vulnerable groups. Now, instead, universal social protection systems provide a reliable instrument that people can access in times of need throughout their lives, minimizing the risk that adverse situations become amplified and sustained while providing a route back to economic and social inclusion. The third area is governance and politics, and we've seen this infused throughout the crisis. Survey responses confirmed that impacts and responses are shaped and conditioned by pre-existing modes of governance in each setting, including the relationships and levels of trust between federal, state, and local governments. Nor can the pandemic be separated from politics. This is particularly true at a time of polarization and increasing nationalist sentiments. At the national level, this has played out most clearly in the presentation of an artificial choice between public health and the economy, when the two are thoroughly intertwined. The pandemic has also had implications for global governance and coordination on tracking and treatment at a time when trust between countries is being tested on other issues such as trade and climate change. Covid-19 has also presented opportunities for lines to be redrawn in continuing battles between facts and information, between privacy and tracking, between freedoms and security. So more research is needed on how politics and governance influence state responses to the crisis, while recognizing at the same time that considerable support has been provided by non-state actors who need to be a funded part of the response. The fourth area is our relationship with nature. The pandemic and a number of responses have urged us to question our relationship with nature and the planet. Now, more transformational types of crisis response would shift economies and societies into the accelerated adoption of renewable energy, greater use of telework and virtual meetings, less air travel and other polluting forms of commuting, and greater respect for biodiversity and the exclusion of animals from our food systems. Now, it remains unclear at this point whether the appetite for such transformative change has increased as a result of the pandemic, or if we'll eventually slip back into business as usual. Therefore, we think that more research is needed into attitudinal shifts as a result of the crisis, and whether they change the politics around sustainable consumption and production and strengthening environmental governance. And lastly, societal values and solidarity. Now, many survey responses offered reflections on how we organise economic activity and social policy, how we value the contributions that individuals make through paid and unpaid work, and how we shift the needle back towards collaboration rather than competition. So the just-in-time manufacturing and supply chain logic of international trade has been questioned in relation to PPE equipment and essential medicines. Doctors and nurses have been applauded for their bravery and sacrifice. Paid and unpaid carers and delivery drivers have been deemed essential workers. The question is whether this eventually translates into greater remuneration or workplace protections, especially if some countries eventually have to revert back to austerity. There's also a lot of evidence of strong voluntary and community engagement. Yet the international picture has been more pessimistic, with countries trading blows over the origin of the crisis, shifting blame for failing domestic responses and competing for medical equipment. And so lastly, the consequences for multilateralism remain unclear and provide a further topic for research. So I think this is already quite a full research agenda, but directed very much on how we can build back better in a simple way, but make sure that it's a transformative change that protects the most vulnerable in society. Back to you, Jennifer.
Thank you so much. Thank you, Paul and Eva, for that very rich presentation of the very rich results of our survey. I'd like, before I hand over to our discussant, to Rakaya Aidara, I'd like to remind everybody who's taking part in the webinar that we do have the Q&A feature open to collect your questions. So please type in some questions so that we'll be able to turn to those as soon as we start that portion of our event. Now, I'd like to turn over to the floor to our discussant, Rakaya Aidara, who is a policy specialist at the Water Supply and Sanitation Collaborative Council, WSSCC, a United Nations hosted organization at the heart of a global movement to improve sanitation for everyone. Rakaya, you have the floor.
Thank you very much, Jennifer. It's an honor to be here. I first would like to thank UNRISD and all the panelists. Thank you very much for the inspiring remarks and for all the information you provided on this pandemic, Dr. Navarro. And thank you, Paul and Eva, for all the insights from the report. Before I start, I would like to share with you one video, actually. And I thank here our partner, WaterAid, for producing this video about the situation of women sanitation workers in India. So I will share my screen right away, and then I'll get back to you.
खाना पीना आदमी को राशन पानी जो पहले चलते थे वो सब भी बंद हो गया है। कपड़ों से प्लस राशन मिल रहे हैं, वही से गुजारा कर रहे हैं किसी तरह निमक भात माँ बाप करके। प्लस फिर जो लैट्रिन बाथरूम धोने जाते थे वो भी सब मना कर दिए कि कोरोना की वजह से भी नहीं आना, बीमारी फैलेगा, कोरोना हो जाएंगे, इसलिए सब भी मना कर दिया। घर बैठे बाल बच्चा को पढ़ाई लिखाई में भी दिक्कत हो रहे हैं। तो कुछ नहीं कर रहे, थोड़ा बहुत जाते हैं, घूमते फिरते हैं, तो 2-4 पैसा का काम हो जाता है। 50-60 रुपये का उसी में से जो चला लेते हैं साग सब्जी। कभी मिलते हैं, कभी नहीं मिलते हैं। देखते हैं दरवाजा में तो ढुकने देवे नहीं करता है, उधरे रहो, जा भी काम नहीं करा, जो भी करा नहीं करता है वो भी नहीं करा, ये बीमारी फैल जाएगी। सरकार तरफ से तो कुछ मदद मिल नहीं रहे हैं। कि घर बैठा खा लेंगे अपना। सरकार तरफ से कुछ मदद मिलती है तो घड़ी घड़ी हम लोग को भटकना नहीं पड़ता, घूमना नहीं पड़ता।
यहाँ पर मेरे पास कुछ धंधा है ना पानी है साहब, और ना मुझे कुछ मजदूरी मिलती है हम तो बोलते हैं कि नेता समाज है, इसको कोई काम नहीं देना है।
कोई भी काम नहीं कर रहा है अभी लॉकडाउन में, तो किसी को कोई काम मिल ही नहीं रहा है। मेरा भी काम बंद है, बहुत दिक्कत हो रही है।
I demand government, they must take the dignity, self-respect and right to life of the scavengers must be the priority, national priority. So those agencies, organizations and individuals, the part of the wash, must take a kind of a time-bound action plan. There they have to put the very clear priorities. Then that they have to see that it is happening across the globe, not just in one place.
Thank you very much. I think that I found actually this video very inspiring, and I thought I would share it with you today because we've been talking a lot about lives versus livelihoods. Actually, I like very much that theme, which is the one chosen by UNRISD, to talk about the tension between this need to provide safety nets in terms of social protection to populations and to put in place protective measures against the virus. As we have seen from both the report and the video, COVID-19 has severely impacted some groups and at many levels, despite the fact that they were not affected by the virus. So first, I would like to focus my intervention on key issues highlighted in the report. Then I will share some perspectives on future research that can help inform future policy development across regions and income levels. First of all, COVID-19 has shown that gender inequality is a reality across regions and a major concern in high-income countries where working mothers had to juggle between multiple responsibilities. As a gender advocate and the representative of an organization working on water sanitation and hygiene, I'd like to spend some time maybe on one topic, which is menstrual health and hygiene. It is really one of the areas of work that we have developed as WSSCC, and we've noticed that even during the COVID-19, it was a major concern for women. They reported the lack of access to menstrual materials. For example, in India, subsidized sanitary materials were no longer available for many young women and adolescent girls as public schools closed. And the lack of availability of water in both rural and urban areas exacerbated the contamination risk as well as population's fears and protests in many parts of the world. I know it was the case, for example, in sub-Saharan Africa, where we can take the example of Dakar. Populations from the city there were a lot of protests actually, because just before the COVID-19 started, there were lots of water shortages and people were desperate to get water for days. In some cases, the lack of water also aggravated the marginalization and isolation of some specific groups, as we've seen from the video. Healthcare workers were confronted with the lack of sufficient medical equipment and insufficient access to materials such as masks, but also sanitary pads for nurses and other women health professionals. They reported their difficulty to change their sanitary protections at work during menstruation due to the high volume of work and due to the need to take care of patients coming in. The paper notes that many actors, governmental, non-governmental, private sector, faith-based organizations joined forces to ensure the continuity of services. This included delivering sexual and reproductive health services, information on menstrual health and hygiene, distribution of sanitary materials, distribution of food and contraceptives, etc. However, the restrictive measures put in place by governments to stop the spread of the virus were a major challenge with regards to mobility, the closing of borders, etc. I would also like to highlight one group which is often forgotten, which is people living with poverty. Organizations working with this group highlighted the difficulty to continue providing a timely diagnosis and delivering treatments while fighting the stigma and discrimination they were often subject to. In fact, generally speaking, the supply of materials is still a major issue, especially in low and middle income countries. Civil society organizations from these regions expressed concerns about governments' long-term strategies and capacities to supply health centers with medical equipment and vulnerable groups with protective materials, food, subsidized water provision, etc. And the issues around supplies availability also shape the political discourse and policy responses in both low, middle income countries and high income countries since the start of the pandemic. We appreciate that the report noted the massive movement of solidarity that emerged across the world. Not only international organizations and NGOs contributed to this effort, but we've seen it, private sector companies as well, faith-based organizations, local think tanks, trade unions, individuals. And I would like to mention also the news industry, which has been through a major crisis, we know, in many countries, especially in high-income countries. However, they have been able to provide an impressive volume of information on the COVID-19, which was also very much appreciated by the general public in terms of its quality for free. Let me now highlight a few issues that may require further attention and that could be developed in future research. I think they all fall actually into the 5 categories that Paul has highlighted earlier. Maybe just 3 of them, I think, where we felt like there are very specific questions that we have under these 3 categories. So the 3 categories are universal health and social protection systems, governance and politics, and social values and solidarity. So the first point, as the COVID-19 erupted, government's policy responses have also been contradictory and confusing, and they caused distrust and protest within the population. In a country like Switzerland, for example, pregnant women were listed as a high-risk group in the government's policy documents. They no longer are, and this created an important movement of protest within women organizations and feminist movements. Similarly, we've seen conspiracy theories emerging and growing across all regions and income levels and influencing actually policy decisions. What were these factors' influence in shaping populations' understanding of the sanitary situation? It's a very critical point that was raised actually in the report and earlier by Dr. Navarro. The second point, in high-income countries, COVID-19 has shown the vulnerability of healthcare systems that are more and more privatized. Did the pandemic help advance the debates and demands for an adequate treatment of healthcare workers and for more public healthcare institutions in high-income countries? How sustainable is the movement that is these trade union movements that we've seen, for example, in many countries? How sustainable are they? And will they survive after the COVID-19? It would be nice to know whether this pandemic has helped them in their fight for more social rights. The third point, during the COVID-19, as Dr. Navarro explained, one of the measures that is used and that is very efficient is the isolation of the infected individuals. One thing that we did also was to isolate high-risk population groups. What was the impact of this on the mental health of these groups? I'm thinking, for example, about the elderly. Did this isolation had an impact on their mental health? Lastly, as rightly pointed out in the report, more research is needed on how politics and governance influence state responses to the crisis and ultimately the health and well-being of people in all countries. Some governments have assumed extra powers to ostensibly address the crisis, often without increased democratic checks and balance to ensure accountability. And here I was quoting the report. We think that this is a critical topic that requires an analysis of emergency policies and laws that were implemented during the COVID or that are still implemented as we are in this COVID-19 crisis. 2 examples. One is the example of Italy, for example, where many migrants were, where we've seen a regularization of migrants without papers. supposedly to give them access to social protection and health care. However, we also know that these regularizations were only restricted to migrants working in specific sectors, such as the agriculture and food processing industry. Another example is the extension of power of police forces that was also mentioned in the report, which has led to many human rights violations in both developed and developing countries. I think that UNRISD is in an excellent position to carry out this additional research, building on its vibrant network of partners. I look forward to the discussions and I thank you for your attention.
Thank you so much, Rakaya. Now, I see that while we were listening to Rakaya, Dr. Navarro had to leave us for another engagement. So unfortunately, I won't get to thank him while he's actually here, but just to have that out there that unfortunately David has had to leave us. Thank you, Rakaya, for your intervention. I think that really, I really like the way that you used the video to bring additional grassroots level, ground level examples that really echo many of the findings that were presented in the report. And I appreciate also very much at the end your suggestions for areas where future inquiry really could shed valuable light on the challenges that we have before us. So thank you very much for that. Now we're going to turn to our Q&A portion of the webinar. Again, please use the Q&A feature to type in your questions. And I see that we have had a bunch of questions coming in. I'm going to try to group them a bit because Paul has stepped away for just a moment. He'll be back soon. But I thought maybe I could start with some questions about the respondents to the UNRISD survey. And Eva, maybe you can start to give us some insights in response to these questions. So one of the questions related to was there any information or response related to the role of non-state armed groups like gangs or organized crime in any of the response measures or forms of response that were raised in the survey responses. We also had a question, several questions about specific vulnerable groups. So one related to whether religious minorities explicitly were covered in any of the survey responses as a vulnerable group. Another question related to youth and younger people as a vulnerable group specifically, and how the COVID-19 and response measures were affecting social relations among youth and younger people. And whether this was addressed in any of the survey responses. Yeah, so maybe we can start with that set of questions.
Absolutely. Thank you, Jennifer. Thank you very much. So I see that indeed there are many vulnerable groups that were covered in our survey, and we managed to group them in these main groups based on the UN framework. But not for this reason, it means that these are the only vulnerable groups relevant around the world. So regarding non-state armed groups, we didn't have evidence of this yet, but the survey is still open, so there is still possibility that we will get some insights. I think that what we heard about non-armed groups, there was maybe one response, if I recall very well, that mentioned how they were maybe organizing, containment areas. But it was maybe one mentioned, so we didn't have like large evidence on that. Regarding religious minorities, absolutely. But instead of recognizing as a vulnerable group, we saw how active they were in the response. So we saw that they actually provided solutions during the crisis. So they really tried to bring their community closer And for example, remember in India, there was like Muslim minorities that organized and, you know, tried to bring the community together to distribute masks. So we really saw them, yeah, they're vulnerable, but they also try to organize themselves to provide a response to the crisis. And lastly, I think about youth. Youth, absolutely, it's already in our category. If you see, they have been mentioned more than 60 times in our report. And adolescents, children, and youth, and especially girls and young women. Their social relations, of course, they have been changing. But also, we have to remember that this survey has been running during the lockdown also. So, you know, to which extent can you have social relations during the lockdown? And I think it's very interesting. If I remember well, I saw this question going in. It was from Italy. And I think it was in relation to sport and activities. And of course, in Italy, we have been hardly hit. And it was not even possible to go out and, you know, practice sports. So I understand that this could be a relevant point to further explore. And maybe we will have more interesting answer, not if we keep the survey open, and that, you know, maybe social relations are starting again, and we can understand how they're changing in time. So yeah, this would be a first overview. I don't know, Jennifer, if there was any other specific technical question that you want to raise.
For now, I did miss one in terms of raising a question about specific vulnerable groups. There was, yes, people with underlying health conditions, of course, this specific question about kidney failure patients. But yes, absolutely, we do know that certainly people with underlying health conditions were at increased vulnerability for many reasons, from their underlying condition to the constraints placed on medical care as a result of shifting priorities during the height of the spikes in pandemic. I see that Paul has joined us again. Welcome back. We've just gone through one round of a bit more of the technical questions on specific vulnerable groups and whether they were specifically mentioned in any of the responses to the survey. There were several questions, and one question in particular that's got several upvotes, which is how did you reach the vulnerable groups and motivate them to take the survey? And then a similar question, I think, about, well, yes, how were vulnerable groups reached and motivated to take the survey? And I thought maybe, Paul, you could talk a little bit about that and who actually responded to the survey and who we solicited input from.
Yeah, thank you, Jennifer. Yes, as I tried to caveat at the beginning, we wanted to do something in real time that could provide some very rapid insights to policymakers. UNRISD is a research institute within the UN, but we operate through a very, very large global network. And we thought one of the quickest things that we could do was tap into the expertise and experience in that network. Now, that network typically comprises practitioners and academics who are clearly living in different parts of the world and who can quickly ascertain what's happening on the ground where they live. But it was not a survey directly of the socioeconomic impacts on vulnerable groups themselves. I think that is for a future part of research where we have the time and access to the groups. However, that said, we did actually have quite a large respondents in some countries which were clearly from groups at risk. I'm thinking of Costa Rica. We had quite a lot of responses from domestic workers in Costa Rica. But it wasn't our intention. Our intention was to be as quick as possible and to tap into the expertise in our network.
I think that hopefully responded to the question and reminded people of the remarks that you made at the outset about how we ran the survey. There's a comment in from Kogi State, Nigeria, which raises the point that vulnerable ones are not limited to those that have been in contact with COVID-19, but also the informal workers and people whose livelihoods are restricted due to lockdown. And so I think that that certainly bears repeating. That's one of the key findings from the report. There's an interesting question about root causes, and this is something I think that resonates very closely with much of the focus of UNRISD's work in a vast sense, not only in related to COVID-19. The question is, how can the United Nations and World Health Organization help in resolving the issue on the root causes of this pandemic? I think the question might be looking at, you know, the true identity. Is it a virus or a bacteria? But for me, what's interesting and what we might like to hear from our panelists about is the root causes also of the vulnerabilities that make people more susceptible to the grave consequences of this pandemic. So I'd like to just put that question there and invite all of our panelists to respond.
Any particular order?
No, please go ahead. You've unmuted your microphone first, so please go ahead, Paul.
Okay. Yes, I think clearly the scientific community will hopefully in the next short period get to the bottom of what the true cause and origin of the actual disease vector was. I think what the survey tries to do and what UNRISD has tried to do in its existence is try to get to the bottom of what makes people susceptible to economic and social change that then adversely affects them. And for us, that means delving right into power relations and politics and how people relate to each other and the assets they have at their disposal. And clearly in a framework where you don't want to leave people behind, you can clearly uncover lots of horizontal inequalities that are based on discrimination or exclusion for any particular characteristic. I think what the survey reinforces is that, and David mentioned in his opening remarks, is that poverty itself can be a primary driver of insecurity and vulnerability when something bad happens. And that can be compounded then by additional vulnerabilities that may be because of group circumstances or context. And so if you recognize that, then the policy responses are systemic and comprehensive and holistic in as much as the SDGs tried to achieve. And I think one of the important ones for UNRISD in our research in the past few decades has been around being more resilient in the support that we provide people throughout their lives when they go through hardships. And that points to more universal systems of social protection and service delivery. And I think that's been particularly important for the pandemic. So I think, you know, there are lots of institutional responses that you could put in place that would even be effective if there were a future crisis, whether it's economic, environmental, or health. But the point is that many countries around the world have not invested in those types of systems and therefore remain vulnerable. And unfortunately, what we've seen is that those vulnerabilities are universal. So we've seen countries all across the world, poor and rich, being very severely affected by this pandemic with their populations in those countries. And there's a story to tell about how prepared they were and the systems that they didn't have.
Thank you, Paul. Rakaya, would you like to add anything on that?
Yes, thanks, Jennifer. To me, it really makes me think about the video we've just seen and people saying that they're more afraid to die of hunger than to die of COVID. So it shows us that actually these groups they were already vulnerable. before the pandemic started, but then after the pandemic, they were even more vulnerable, but because of some of the measures that were put in place. And there are no system actually that guarantee them, no social protection system that guarantee that they will have food, that they will have water, sanitation, shelter, as outlined in the report. So I think that I really would like to echo what Paul just said, which is the need to put in place systems and institutions that can respond to these critical issues, and it cannot be done overnight. So right now we are in a situation where many countries do not have systems in place, and yet they have to find solutions, put in place restrictive measures, and we need to learn from other countries and see what's working in other countries. For example, in locations where they were able to set up mechanisms to allow some workers to go to work while others are not going to work, where, for example, for the school, we've seen that in certain schools, there were part-time modalities that were set up. That was done also in some markets, for example, in Jordan, etc. I think we are now at a stage where we really need to learn best practices and to share them rapidly, so that the countries that are in a situation where there were no systems before, no institution, and the political leadership is weak, so that these countries can learn from these best practices and try to apply them as soon as possible.
Mm-hmm. Yes, and to echo also what Paul and Rocalia said, to have a more resilient policy response, a more complete policy response, you need to know who are the vulnerable groups. And this also came out in our survey. So really the lack of data, the lack of information, our countries don't know where they should apply their policy, how the response should be designed to really be inclusive, because then if the policy is not designed in an inclusive way, you only exacerbate existing inequalities. So in a system change, I mean, this is where I see the system change, is already to know better before, well in advance, what are the policies that are already inclusive and that can respond to any crisis situation, making sure that those vulnerable people are already included in the crisis plan, in the response plan, and that is not something that you think about later, like, okay, now the policy is affecting the vulnerable. You should think in advance. So this was really a big takeaway for me, and I really think that it's the starting point to create system change. So really know where the change in the system should be created. So know who are the vulnerable groups, which are the most vulnerable also businesses, the small SMEs that might need a lot more of support in this crisis situation, especially in lower income countries.
Thank you. Thank you all for your responses on that. I've just tried to group together a few more of the questions that have come in. So we have a couple of more questions going back to specific vulnerable groups. One, there was a remark and an associated question. The remark was a surprise that only 60% of the responses to the survey specifically spoke of the gendered impacts of the pandemic and response. So I guess whether you'd like to, you have any comments on that and on the impacts on women. And then the second question regarding specific vulnerable groups related to informal settlements and residents of informal settlements, and whether there was any indication in the survey about how responses were being dealt with in those settings. I'd also, I'll group together a couple more questions because I realize we're nearing the end of our time. So those were in terms of the specific vulnerable groups. And then there were a set of a bit more forward-looking sort of big issue questions. And one was raising concern about what really concretely can be done and needs to be done to preserve as many gains as possible in terms of on the human development front in the current context. And relatedly, there was a question about does this context and COVID-19 pandemic prompt us to consider revisiting the SDGs? And then a third sort of big question is this the time now to think seriously about establishing a global solidarity fund for social protection? And yes, so I think I'll leave it at that. And again, invite all three of our panelists to respond. Obviously not to everything necessarily, but to those questions that you'd like to pick up. And maybe we'll start with Rokhaya, then go to Eva, and Paul can have the last word. Over to you. Thank you.
Thanks a lot, Jennifer. Maybe I'll pick up the points on the vulnerable groups and gender. I think we are at a stage where in low and middle income countries, we need to prioritize these groups. So, and we need to look at the long-term strategies as well and what is possible to do with the available resources in the longer run, because we don't know for how long this virus will be around. And if these strategies do not prioritize these groups, they will be further left behind. And even worse than that, there will be, we've seen it in some places, there will be protests, and we don't know how far this can go. So I think the prioritization of the vulnerable groups is definitely one key point and one very solid recommendation that can be made to states and to governments. The second thing is having strategies that are sustainable in the longer term. So we've seen that there were supplies of materials, of medical equipment, etc., but these were very often estimated to be insufficient. In addition, the report highlighted issues around corruption, issues around distrust, etc., issues around food production, food distribution, etc., that were not done at the level that at an adequate level or not done properly. I think there needs to be a revisiting of these issues and to address them properly so that the communities can be served and have a basis, at least at the minimum is the minimum social requirements are met. And then talking about the longer strategies, I think that's where partnerships and collaboration with these different actors that were mentioned in the report is important, both the state and the non-state actors, and everybody who has actually, first of all, the knowledge, because we know that the virus is taking a different shape and there are a lot of information coming from the countries, but also the resources to help tackle the pandemic at the country and local level. Thank you.
Thank you, Rokhaya. Thank you very much. Just to maybe reinforce very quickly your point on women, and then to leave the floor to Paul to elaborate on the last question that was absolutely very relevant in this context. About the only 60% of survey respondents that identify gender difference. It's true that it's not so high, but it's also true that this is what is more difficult to observe. You do not really observe domestic violence if you do not experience it. So when the survey went out and maybe still some confinement measures were in place, it was very difficult to observe, the gender dimension maybe of the policy response, especially at the beginning stages. While maybe now we will have more possibilities to understand, to hear the stories. I remember just watching a documentary about domestic violence rising in Italy last week, but it's something that is coming out more now. And instead, regarding the informal settlements, I think I've already mentioned it before, but just to reinforce it, yes, absolutely. It was really rise of people living in slums and informal settlements. They are more likely to be affected by COVID. And this is also because why we need to make sure that in the urban setting, we have effective policy responses for distribution of free distribution of protective equipment and masks and any other sanitary product that can help those people living in informal settlements to maintain social distancing, to try to solve the problem that they cannot maintain social distancing. Yeah, and this is over for me, and maybe Paul, I leave to you the last remarks.
Thank you. I just wanted to say three things, if I may. I think I picked up on an additional interesting question that I just picked up. I think what was apparent in some of the survey responses from low and lower middle income countries is that they trusted their governments to do some things but not others. And some of the things that they perceived that were more effective were sort of very blunt instruments like closing borders or closing schools. And maybe it was just a sense that the capacity was there to do that sort of quite direct and blunt instrument, but not a lot of the targeted or more sophisticated or nuanced support that would be needed at local levels. So I think in settings where there are data constraints and challenges, and where there are capacity constraints and challenges, and where also there are issues of trust between states and populations and police and security, I think one of the things is that if you push down the response as far as possible to the local level, where there's more information about who might be vulnerable or in need of support, and also if you form compacts with non-government groups that already have pre-existing relationships with groups that may be vulnerable, then I think you can achieve a slightly better degree of support than if you're trying to do it from a top-down level. I think it's appropriate in all countries, but I think it's particularly important in countries that face capacity or data constraints. And then Sylvia's question on the global fund. I mean, I think it was a strong reinforcement that really the majority of countries have inadequate systems of universal health provision and social protection support. Now, it's often not just cash, it's politics that prevents that from happening, and it's the same in both rich and poor countries. Now, if we are to be advocates for stronger social protection, then clearly there are countries that at their current level of development may need additional support from outside, and you could consider a sort of a solidarity global fund for social protection systems. I mean, I'm slightly ambivalent about some global vertical funds because they introduce donors very much into the accountability framework. Quite often there are conditionalities which weaken the response, and there can be extra problems generated, but clearly the objective and the strong aim here is to strengthen social protection systems, either through domestic resource mobilization in a compact with your populations, or if needed, it's so important, then I think a global fund could come in and help a certain number of countries to put that in place. And then lastly, I think the question on how do we preserve as many gains or as much progress as we've achieved on the SDGs as possible. This is going to be quite a simplistic response, but hopefully it does have some truth in it. There is going to be some permanent scarring in all countries that is affecting youth and young people. Their entry to the labour market, their levels of education have been disrupted. Of course, for some even their health and mental health has been disrupted. And I think the best way of preserving long-term social and economic development gains is by making sure that this doesn't continue to be a burden for young people as they grow up through this crisis, particularly if it stays with us for several years.
Thank you very much. Thank you, Paul, for that, I think, very fitting final intervention. And thank you also, Eva and Rakaya, for your responses to that last round of questions. So I think that brings us to the end of our hour-and-a-half webinar with you all today, and this launch of the UNRISD report on COVID-19. In closing, I would like to thank my colleagues in the UNRISD communications and outreach team for producing the report and this webinar. And I'd also like to thank specifically Sergio Sandoval for his role as the technical host of the event today. I think everything went smoothly, and I hope that it went smoothly also for all of our attendees. Many thanks again, one final time, to our panelists, David, who unfortunately had to step away at 5 p.m., Paul, Eva, Rakaya, for your contributions. Thank you also to the members of the UNRISD network who responded to the survey, and to everyone who attended today's webinar. Goodbye until next time, everyone. Thank you.